be the pulsing rhythm when you feel you're drifting off the beat. Oh, you wanna run to me, wanna run to me. I'll be your soul shaker, I'll be your rainmaker. So tell me, are you ready for the fire, for the fire? I'll be your storm chaser, I'll be your human nature. So tell me, are you ready for the fire, for the fire? We ain't got no limits, we're standing high, yeah. But we can see the world through a diamond eyes, ain't no need to hide. And I'll give you shelter till you're warm inside. This stormy weather can't break us if it tries. Just take the ride. Oh, I'll be your soul shaker, I'll be your rainmaker. So tell me, are you ready for the fire, for the fire? I'll be your storm chaser, I'll be your human nature. So tell me, are you ready for the fire, for the fire?
Hello, everyone. Thanks so much for joining today. It's so wonderful to have everybody joining us today at this event. So welcome to the Strategy Priority in Practice session of the Alliance meeting. It focuses on contextualization as part of localization in refugee settings. Today being World Refugee Day, it's a very pertinent topic to cover. My name is Cliff. I work for UNHCR, and I'm going to facilitate this event together with so great, wonderful speakers who are joining us. So just to quickly introduce the speakers today, we have Amy Gabriel, who is from World Vision. She has over 19 years of experience in both humanitarian and development settings, with expertise in child protection, programming, participation, safeguarding, and advocacy. Amy has held various positions and roles in child protection, providing technical leadership and support in multiple countries in Asia-Pacific region over the past 5 years. Welcome, Amy. And Amy will be joined by Janna, who is an adjunct assistant professor at the Columbia University Mailman School of Public Health. She is also a lead in the research unit of Women's Refugee Commission. And Janna is an expert in measurement and evaluation approach to child protection programs, and has experience of over 15 years supporting field teams. And together, both Amy and Janna will be joined by Job, who is joining us from Uganda. Job works for World Vision Uganda. He has 10 years of experience designing and implementing child protection in emergencies and development programs. And he has previously worked for Save the Children and Plan International in child protection programs. Job has led the establishment of the child-friendly spaces for World Vision Uganda in relation to the refugee influx from South Sudan. So this is the area of topic that they will be presenting today. Then we will move on to Mara. Mara is a research practitioner with over 10 years of professional experience in child protection and forced displacement in Latin America and Europe. She has worked for UNICEF, the University of Edinburgh, Care Columbia, and the refugee program of the Hungarian Helsinki Committee. she has long interest in doing research to reflect the child protection sector's practices and connecting that theory to practice as well. And our final speaker will be Oscar, who is a lawyer from Peru, and he has 15 years of experience in the field of child rights, holding positions of the Director of Special Protection and General Director of Children and Adolescents in the Ministry of Women and Vulnerable Population in Peru. Oscar is currently working as a specialized consultant on children's rights for UNHCR Peru. Thank you so much, all of you, for joining, and we really look forward to hearing you. So I just wanted to quickly talk about localization and how it's framed within the Alliance strategy. If we move to the next slide. So as you see, the Alliance strategy 2021 to 2025 highlights localization as one of its strategic priorities. And this means, of course, the Alliance itself believes in an expanded understanding of localization and that it should guide equitable, dignified, and principled humanitarian action. By this, the Alliance means addressing existing privilege and power structures in humanitarian decision-making, financing, and programming intervention. It also means working towards a mutual sharing of knowledge, skills, and opportunities with an intentional shift of power. So if we move to the next one, and I'm sure many of you probably joined the previous session, which was on the celebration of the World Refugee Day. And we heard a refugee actually talk about the importance of ensuring refugees themselves are part of and they are leading solutions for refugees. This not only means local and national child protection actors, but also communities and refugee-led organizations themselves. How we promote and facilitate protection and opportunities for direct and flexible funding for these actors are critical for our work in localization. As you will see in the next slide, the strategy of the Alliance has 3 specific objectives for our sector. One is the meaningful participation, meaningful and principled engagement of communities, local actors, national actors, and recognizing them as equal partners in the development and contextualization of child protection standards and guidance, tools, and interventions. We are all used to developing all these guidance in silos, separate from refugees, and introducing them as part of our programs. But with our new objective, we aim to transition from this approach where we involve and ensure that refugees themselves and the communities and children themselves are part of the solution and part of the process. The Alliance objective also highlights the importance of creating and expanding equitable opportunities to share, exchange, showcase learning, knowledge, and expertise amongst refugee, local, national, and international actors. Rather than being one-sided, delivering programs and learning for our own selves in order to better improve our interventions, it is important that this is done together with the refugees and together with other people who are forcibly displaced, and ensuring that they are part of this as well. And finally, improving and expanding accessibility and diversity in the learning opportunities that strengthen child protection, technical expertise, and grow institutional capacity is also a critical objective for the Alliance. While the 3 presentations, through 3 presentations, this will highlight some of those efforts and critically examine what we are doing and what we need to be doing. We encourage the participants to also reflect on their own operational context, consider how localization can be achieved within the areas where you're working. More so in that what localization actually means to the refugees, to the displaced people, be they IDPs, be they stateless people, and how it aligns to their own priorities. So while listening to each speaker, do reflect on on your own context. Do consider how localization works and needs to work in your operations as well. As we listen to the speakers, I encourage you to put in your questions in the chat box, which then will be posted to the presenters who just spoke. And we'll hear more from them to try to answer the question that you have. Towards the end of the session, we will have a Jamboard exercise where we'll also consider what else we can be doing and what else you think you should be doing as you move forward in ensuring there is a community engagement, refugee engagement, and it aligns with their own priorities and the ways they feel that they need to be implemented in their operations. Having said that, I would like to invite Amy, Janna, and Job to take the floor and talk about the work that they've done in the refugee settlements in Uganda.
Thank you so much, Cliff. And myself, Janna, and Job are quite delighted to be joining you all today to talk about the findings from our multi-year study, country study that we did in the South Sudanese refugee camp, together with the children, adolescents, and their communities as part of the West Nile refugee response of World Vision in Uganda. If you could go to the next slide, please. And the next slide. So for those of you who are less familiar with child-friendly spaces, the basic premise of how these interventions create change is that if you engage children in a safe and secure environment with structured activities led by trained and supported animators, then they will feel and likely be more protected. There will be more improvements in their psychosocial well-being, including the acquisition of skills and knowledge, and the community and carers around them will be motivated in support of their care and protection. Next, please. So over the past decade, we have worked in partnership with various organizations, including Columbia University, of course, our partner in Uganda, AfriChild, and also, of course, our program team in Uganda to evaluate the effectiveness of child-friendly spaces, or CFS, in its various forms across a range of diverse humanitarian emergencies to evolve how and when and for whom these are most effective. When we started this research over a decade ago, we were faced with a range of contextual and methodological challenges to overcome. As many of you know, CFS were and are meant to be flexible in nature to be able to respond quickly to the needs of children and their families in the acute phase of response and scale up as needed. Naturally, the activities can vary quite a bit across contexts, and thus a basic package of services had to be defined and then evaluated. The first study series that we did had looked at particularly exploring how important quality implementation is to produce positive impacts for children, and how quality hinges upon the applications of skills and relationships of the animators with the children. This foundational research across 6 different emergency contexts found that CFS overall has positive, albeit modest, impacts, and particularly with regard to the psychosocial well-being and protection of children in the short term. The extent of these impacts varied by the age of the children, their gender, and whether these activities were tailored appropriately to fit local circumstances with respect to both the general context and the specific risks faced by the children. Additional exploration also revealed mixed evidence as to whether these interventions have lasting benefits for children who had attended. And building on this, we launched this study, which we are now going to talk about, in a context where some of the greatest impacts were demonstrated. And this is particularly in the West Nile response in Uganda. And in this study, we sought to affirm a framework to improve and sustain mental health and psychosocial well-being for children within this existing and evolving CFS interventional model. I now hand over to Job and then Janna to talk more about the study and the findings.
Yeah, next slide. I'm going to talk about the toolkit that was developed with enhanced quality assurance through the new operational guidance. In the toolkit, earlier CFS practice had evolved into a higher quality intervention and thus requiring additional investigation. particularly around its longer impacts on the children or youth that involved in child-friendly space activities. Building on the previous findings, it was also critical to implement and evaluate a more deliberate package of structured psychosocial sessions that may have the potential to better address the different needs of girls and boys at varying development stages. This tool, which was particularly developed in 2019 by World Vision and International Federation of Red Cross, provided enhanced operational space, training manuals for implementers and facilitators, as well as activity catalog featuring the different sessions that have been categorized into 7 sequence of psychosocial themes that could be orchestrated and into 4 different sessions throughout the lifespan of the program. Next slide. This particular research had a specific objective, and in this study, our aim was to identify the immediate and long impacts of each of these approaches, and that is currently the standard approach that is being used by most of the practitioners, and then the toolkit approach that was developed on children's mental health, psychosocial well-being, and protection, and then comparing the effectiveness to each other and those receiving no intervention at all.
I think we lost a connection with Job. Over to you, Amy. You're on mute.
Sorry, can you all hear me okay?
Yes, loud and clear.
Okay, so I think we're still on slide 5. I'm just going to pick up from where Job was speaking to, and I think he was mentioning about the study aims. And so we basically looked at the both the immediate and the lasting impacts of each of the 2 approaches. So one looking at the standard approach, and the other one is looking at the newer version, which is this child-friendly space toolkit, studying both the different areas, which are the children's mental health and also the psychosocial well-being, as well as their protection, and then comparing their effectiveness to each other and to those receiving no intervention. So the standard approach is basically what practitioners are currently and mostly using in their work, while the toolkit is the newer one and is the more rigorous structured approach mentioned previously. The secondary aims of this research also included determining the cost effectiveness of each of the service package in achieving the primary outcomes, also assessing the impact, if any, and then looking at the implementation of CFS as it has the effect on formal and community-based child protection systems. It also looked at identifying local constructs of child well-being and resilience, and also if and how these have shifted over time. To achieve this, we launched a mixed method, randomized controlled trial, assessing children and their caregivers at pre-intervention, post-intervention, and then 9 months following the end of the intervention. The children were randomly assigned at baseline and then followed throughout the study period using locally validated measures and engaged in participatory activities at pre and post assessment period. Next slide, please. So participatory activities were also used to identify the systems of support, care, and protection that exist for children in response to protection concerns in their settlement. Participants were asked to identify the resource persons and institutions available for children in the settlement, including the type of service or support they provide, and also any challenges in accessing these supports. Adolescents were also asked to draw their community as they see it to learn more about how accessible these community resources are for adolescents themselves, and also areas within their community that are protective and promotive of their well-being and protection. Before we present the findings, we will move on quickly to the findings, but also we would like for you to engage and tell us about what you think of the question, which should be hopefully shown on the Jamboard on the screen. And this particular question that we are asking is, for us, is particularly relevant, but especially on the theme today, but also on one of the findings of our research, which was highlighted, that we are also going to talk about a little bit more in the following slides. So please go ahead, share us your thoughts and tell us how you engage with local communities, in particular with children and adolescents, to determine what appropriate interventions can be used at the start of the response. Okay, so hopefully you should be able to manage Jamboard. If you can just click through one of the icons on the left-hand side, there should be a sticky note in there where you can add your responses. Please go ahead and share your thoughts. And I'm going to hand over to Janna now to talk more about the findings of the research.
Thanks, Amy. And welcome to our newest research team member who's home with a fever today. So I want to talk a little bit about what we found. And I think we can go, we have one slide on this one. Let's see if we can find this slide. There it is. So what we found in the immediate term is that both the toolkit and standard approaches led to clear positive mental health impacts for younger children. And it did have varying impacts on adolescents. The standard was more effective than the toolkit in helping to reduce psychological distress, particularly for adolescent ethnic minorities in the short term, as well as increase hopefulness amongst younger children and enhance individual capacities for resilience in adolescence. I think on the next slide, we'll see over the longer term, both the toolkit and standard programs led to a clear reduction in perceived risks and psychological distress. However, the toolkit was more effective in strengthening capacities for resilience. When exploring the different effects by gender, which you'll see here, we found that the toolkit was particularly effective in sustaining change, especially amongst girls. Both younger and adolescent girls had longer lasting improvements in mental health after attending the toolkit program. Younger girls were more resilient, whilst adolescent girls were buffered from using more negative coping strategies. On the next slide, you'll see boys, where we found that younger boys in both interventions had immediate and lasting improvements in mental health. The standard approach was more effective in reducing protection concerns and daily stresses of caregivers and had longer-term benefits for boys. On the next slide. And Job, are you back with us?
Yes, I'm back.
Great. Over to you.
Yes, among other findings, the standard produced positive change among ethnic minorities in the immediate term. Meanwhile, the toolkit did so for long term. Here we saw an increase in the functional literacy scores for those younger children and reduced symptoms related to arousal and reactivity for adolescents. Among these adolescents, the toolkit also outperformed the standard in increasing resilience, including relational capacities for supporting it, as well as reducing psychological distress.
I think when you also look at the care environment, it's critical to mental health and well-being of children. We know that. We measured parental stress to understand further how the intervention impacts its levels, if at all, and whether these were associated to any benefits for children. And we did find that female caregivers of young children attending the Toolkit program reported higher levels of stress over the study period. And this was associated with negative outcomes, such as lower levels of hopefulness, as well as positive impacts, including higher levels of functional literacy and lower levels of psychological distress.
Yeah, when we also did look at, when we're comparing the effectiveness of both standard and the toolkit on community structures, we realized that both programs had limited impact on strengthening community capacities for child protection and mental health and psychosocial support. Here we are noting that the child-friendly space lacked intentional mobilization efforts, yet the community protection system was highly interactive and connected. The most common resource for children noted in participatory discussions were international NGOs providing a range of services from food to healthcare to income generating activities, including non-food items. Office of the Prime Minister, which is a government body that is regulating the functionalities of the settlements in Uganda, was frequently noted for their role in enabling access to services within the settlement. Block leaders and village chairmen were the most common community resource persons reported to address children's basic unmet needs, as well as acting as the key interlocutors, enhance access to services and supporting protection reporting mechanisms within the settlement.
So let's go to the next slide. I'm conscious of time, so let's just wrap up and talk about really the main conclusions and findings. And I think if you hold the previous decade of research and perspective, CFS works, and we should use them when they're appropriate. So CFS, when implemented as a primary response strategy soon after displacement, can improve the psychological health and reduce the risk environment for children. Intervening soon after this displacement and then also early in the child's development provides more opportunities to develop those foundational assets and adaptive capacities that lead to lasting improvements in their health and well-being. And so as a first-line response, CFS can be effective when it is tailored to the local context, the circumstances of the emergency, and diversity within the population.
Also, in a protracted setting, efforts should be made as early as possible to integrate CFS into complementary services that coordinate with existing child protection and community structures to provide mental health and psychosocial services and protection services for the whole community. There's clearly more work to be done to enhance the toolkit to further improve their benefits while working to think through and evolve what the transition to comprehensive integrated services should be to support healthy developmental trajectories of children.
And lastly, more attention needs to be paid to the inclusion of caregivers and other trusted adults more explicitly in programming to provide opportunities to engage in development of social and emotional learning skills, enhance communication, and reduce their own stress and its related impacts on child well-being. And so, Amy, over to you.
Amy, you're on mute.
I'm so sorry. I just wanted to say thank you for listening to our presentation. It's been great also working with our team and the research and the program we've been involved in the whole study, but also the community advisory board specifically who have been part of this whole journey with us. If you want to find out more about the research, I think we're going to be sharing a link to the report as well, the summary report in our chat. Thank you so much.
Okay, thank you, Amy, Janna, and Job. That was quite enlightening. I don't see any questions in the chat, but I do have a question, perhaps to expand a little bit more. You mentioned that the importance of contextualization and integrating CFS into complementary services, community structures, and so on. Can you explain a bit further how this can be done to achieve effective localization?
Sure. I think I can start off with a couple of points, and maybe also Janna and Job can also add to it. I think firstly, one of the things that we have always been doing, and for many of us who have been working with refugee communities, is particularly to recognize that there are capacities in the communities that already exist even before we start the programs. And I think it's really important, firstly, to scope out what community capacities are available, what community groups are actually existing, particularly, for example, there will be parents groups or children, or maybe they have one way or another that they're already communicating and coordinating. So it's important to engage with these groups from the very onset of programming. And I think we've heard, even from the beginning of this event today, particularly listening to young people, for instance, that, understanding their real needs and also listening to them in terms of what response might be needed is quite critical and really important for us to be effective in all of this work that we are doing. I think not just particularly in the implementation, it's really important to involve with these community groups, teach, parents, community leaders, and children themselves to be part of the conceptualization and the design of the program. And for that, it doesn't just increase their own ownership, but it also increases their capacity in the long run to be able to be involved in the whole response.
Thanks, Amy. And I do see some other questions coming in the chat, which I encourage you to try to respond in the chat itself. But quite an important point that you made in terms of ensuring refugee communities, particularly young people, are part of the planning and the whole process from the outset. Of course, there are various challenges that we will also see, and perhaps we can touch on that towards the end. Where we have continued influx of newly arriving refugees into the same settlements can pose specific challenges, and we need to think broadly around that. Janna, we have a couple of minutes. Over to you. I see your hand up.
Yes, I wanted to add on to Amy's point just around the conceptualization and the localization process from the research perspective, is that this particular piece of work, we worked in collaboration with a community advisory board who was quite active in the design of the research. So the design and the implementation and what it is that we were actually looking at as a measure of success for this particular intervention. And that we found has been incredibly rich and helpful in ensuring that the findings of the research are taken up and moved forward. So over to you.
Thank you so much, Janna. So we have Mara online, who is going to talk to us about her experience of localization, contextualization as well, in the context of Mexico. So while thanking Amy, Job, and Janna, I hand it over to Mara to come on.
Hello, good afternoon, good morning, or good evening, depending on where you are. My name is Mara, and I will be presenting on some lessons learned, some mistakes, some things that I would like to do better in contextualizing a guide for the foster care of children living in Mexico. So foreign children living in Mexico, usually awaiting for their asylum status to be issued. So next slide, please. So this is a 10-minute presentation, between 10 and 11-minute presentation. I am not going to present the guide itself or the outcome, let's say, of the research, but the research process and mainly the lessons learned and mistakes, as I said before, with the point of emphasizing on the importance of decolonizing the way in which we create knowledge in our sector. My video stopped and I don't know why. If anyone wants we
were having connection problems, so I needed to fix it so we could hear you. Please continue.
Okay, I continue speaking. Okay. So I am not very good at storytelling, but story time. A couple of weeks ago, I was at an event, a very high-level political event for the Americas. Many parallel events on migration and protection, including asylum, refugees, so what to do to improve their living conditions in the Americas, so in Latin America, plus the US and Canada. Many high-level representatives from international organizations saying that refugees need to be included in the response, asylum seekers need to be included in the response, etc., etc. Zero refugees inside in those events. So I wanted to make the point that even though in this specific sector, so humanitarian aid, research that includes affected populations advance very fast. I think that the inclusion of these populations has improved a lot in the past years. This is not the case with adjacent sectors like policymaking, for example, or the making of regional policies or academia too. And I think it is important not only to try to change our sector itself and the way we do things, but also connect the sectors that affect what we do. So that is the point of my presentation. The guide, you can get it online. I made sure that it is uploaded everywhere where you get your research. It is only available.
Sorry, it seems like we have lost connection to Mara. So
I am here, but
you're
this
here.
is not
Okay.
my connection problem, okay? There's something wrong on the other side. My connection is perfect. I live in Silicon Valley, by the way. So my connection is really high quality. There I am again. I appear again.
Over to you.
So next slide, please. If we can change the slide. Good. So if we change or if we divide knowledge creation in different stages, let's say, this is the stage of the need for the guide. The guide completely answered a need from practitioners and frontline workers in Mexico. That is that during the past year, especially since 2011, but especially since 2014, Mexico completely reformed its policies, its legal framework and policy framework concerning the care and protection of children in mixed movements, which means that also practices need to improve. What goes on now in Mexico is that, so Mexico, for those who come from other regions, is a country of destination, of transit, a country of origin too, and a country of deportation. So basically a lot of movement going on in the same country. This guide is specifically, as I said before, for those children who are awaiting for their international protection status, so refugee status or asylum to be decided upon by the authorities. Also, I forgot to say something because of the technical issues. Please, I want to know about you. So if you would be so nice to write on the chat box here on Zoom, what your connection is to localization, where do you do localization from? So do you work at a large organization? Do you work at a university? Do you work from Europe? Do you work from the field? I am interested in knowing this. And of course, any questions that you have, post them, because I want to know what you think about all of this. So next slide. So the guide completely answered the need of, okay, and I see that we only have this in Spanish, but no problem, because I will say it in English and the translators can translate it. As I said before, I want to know about you, we want to know about you, and I have 3 specific questions. One of them, your thoughts about localization and contextualization when it comes to the production of knowledge. So tools, guides, handbooks, policies, programming that is used across many departments of an organization. So this is what I mean by knowledge production or producing knowledge. And this type of knowledge that is then used for policy, for programming across many organizations or across many departments of the same organization. I hope that I am clear. So I am not talking about projects. I am talking about more or less between quotation marks, higher level tools and guides. If you have any opinions about that, I would like to know them, or any advice or anything that you have learned in your work. Next slide, please. Second question that you can answer if you want, always on the chat box, is who should be involved or whom you have seen that is not involved enough. Priority number 2 of the strategic priorities of the Alliance talks about involving populations that are normally marginalized. In my region where I work, so Latin America, it is usually indigenous peoples, Black descendants, so people from the African diaspora living in the Americas, and the LGBTI, also people from poorer backgrounds, and so on and so forth. So I wanted to know what your experience is on that. Third question, you don't need to answer everything. I know this is a little bit overwhelming. What means you have used this? Don't worry, you can answer this directly on the Jamboard that World Vision shared before. So what methodologies have you used in the past to ensure participation by these populations that are usually marginalized from knowledge production? That was my third question. So next slide, please. So some challenges that I found while creating this guide were that we don't have standards in Latin America for foster care programs for children in mixed movements or children, unaccompanied and separate children, children living abroad. I created this guide for UNICEF and RELAF, as you could see in the previous slides. They have a lot of experience, of course, together. They have decades of experience working in alternative care for children in general, but in particular, no foster care program for children in mixed movements have been created in Mexico. When I started drafting the guide, which was in 2017, there were some isolated practices. And of course, there's always the informal practice of foster care, which is very common in Latin America, but there was no institutionalized foster care program. So I needed to look for examples in Europe. And of course, all the time I was asking myself how to make these standards, these guides, these practices that were developed in either some European Union countries. I also use examples from the UK and from Norway into the Latin American context. I see two different problems here. The number one, the way in which we have produced knowledge in our sector. And as I mentioned before, in other sectors, this is not endemic to humanitarian aid. This is a problem that we have in academia also, policymaking, development, the development sector, etc. That is that we have extremely strong legacy of colonialism and imperialism. So usually knowledge is produced in a way that is top-down. There's usually a university or an agency or a think tank or a research center based in the north that works on knowledge production in the global north, usually placed in or located in a colonial country or former colonial country. So how do we deal with all of this? How do we make sure that the tools and the guides that we create continue being relevant for the populations that they are going to benefit, even if our knowledge production practices are the way they are and that we are trying to improve, but still we have a lot of these legacies that I am talking about. And then also, how do we define local? I know that, so the Alliance is using the words local, national, regional, and I like that very much because the word localization doesn't speak to the truth that many times we work in extremely, extremely complex countries. In the case of Mexico, Mexico has 200 million inhabitants or more, 32 states. Mexico is a very cosmopolitan, diverse country. It is a mixture of indigenous peoples, Afro-descendant peoples, and migrants and refugees also. So it is a very complex country. So what does local means in that context? These were very important questions for me to answer while drafting the guide. Next slide, please. Okay, and of course, how to achieve local ownership. So all of these reflections and concerns ended up being in that there was a lot of back and forth with the UNICEF National Office, UNICEF Mexico country office, especially with the child protection officer that is directly in touch with foster care programs, so that works very, very closely with the foster care program from the DIF, that is the Child Protection Services family welfare services in Mexico, completely decentralized. Of course, as I said before, Mexico has 32 states and has one office, one child protection office per state, besides the federal one, the national one. So this is extremely decentralized. This is why it was so important to have continuous feedback loops with UNICEF Mexico. So this is me, basically. This is me trying to explain the research process, because it took 1 year in total. So it was this of January 2017, September 2018, but it was not continuous. So I was not working on this all the time. But it took a lot of time because we needed to have these continuous loops. Me being in Europe, because I was based in Europe, UNICEF country office in Mexico, of course, being in constant exchanges with the foster care programs. So this was really, really important for local ownership, national ownership, and for the guide to be completely relevant to practice in Mexico. So next slide, please. Okay, so mistakes and lessons learned. Mistake number one that I totally, that I know that we were in the wrong, let's say, was that we didn't involve any asylum seeking or children in these movements in general in the creation of the guide. I relied a lot on the experience of the UNICEF country office staff who are in direct contact with children, and also on all of these European guides that were created based on children's experiences. But of course, this doesn't replace speaking with children. And from this moment onwards, so from September 2018 onwards, I am very concerned and very worried about, and very mindful that we need to involve. So what the presenters from World Vision and Columbia University were saying before, involving children not only to ask for feedback or to ask for inputs, but also in the conceptualization and the design of the research. This is very important. And involving them systematically. And then another important point that I want to finish with is what I started basically, that is the decolonization of the way we produce knowledge. There are all of these groups that have been historically marginalized and excluded from the production of knowledge. Those of us who study social sciences know this very well, because we studied that when we are at university. So how did social sciences start? They started by white men from Europe going to their colonies. This is a legacy that we have. This is something that we need to fight against. Democratizing knowledge creation. Democratizing, this is a word. Knowledge creation. The production of knowledge needs to be democratized. It needs to be popularized. So the groups that have been historically excluded, as I said before, need to be included from the conceptual phase of the research. If research centers, universities, etc., are not prepared to do so, they need to change the structures. They need to change the way they do things. This will take a very long time. The same policy making, as I said before, a very important migration and protection agreement was signed in this region, the Americas, last week, with no participation from migrants and refugees. This is extremely wrong. We all understand this, and this needs to change. So this is my call for action for this presentation, that everyone who can do a little from their universities or research centers, or maybe their offices that are located in the headquarters of their organizations, contribute to the democratization and the decolonization of the production of knowledge. And this is it. This is my presentation.
Thanks.
I want to continue this conversation, of course. So if you have any questions or comments, complaints, suggestions or claims or anything that you want to share with me, You can find me on LinkedIn. I am very active on LinkedIn, so Mara Tissera Luna is my name, or I can leave my email here. And please write to me, because this is something that concerns all of us, that we all need to try to improve. But there are some of you or some of us that have more power to improve this than others, and I would like you to be involved in this. So thank you very much.
Thank you, Mara. Thank you so much. Thank you so much. That was a very interesting and reflective presentation on contextualizing something that was created in a different context to a Mexican context. I do see a question, perhaps I can post this for you in the chat, where Laurent is saying a very interesting issue that you are raising, wondering whether there were efforts to research local national practices regarding care for unaccompanied and separated children and research methodologies to do this. We have like 2 minutes, if you can cover that, and then carry on the conversation in the chat.
Yeah, of course. So as I said before, I am the researcher, so I am an independent researcher. I created this research for UNICEF and the Latin American Network for the Right to Live in a Family, RELAF. Together, both of them have many decades of researching on national practices, national local foster care practices. And of course, this was part of the guide. Those of you who don't read in English, you won't be able to, sorry, in Spanish. It is in Spanish because it is localized. In Latin America, we speak Spanish, so of course it is in Spanish. Apart from Brazil and the Caribbean countries, we all speak Spanish, and this is for Mexico. So this is the way it was. So yes, it included the experiences, shows that I didn't do research on these experiences because there's already other research published by RELAF and UNICEF on local and national foster care practices. And as I said a couple of times, the problem when I started drafting the guide was that there was no institutionalized foster care program for children in mixed movements. So this specific thing didn't exist, but there's a very well institutionalized and very well developed foster care program in Mexico in general for all children who need to participate or who need alternative care, let's say. So this exists, and this was taken into consideration for this guide, and it is part of the guide too.
Thank you, Mara. Thank you so much. So we can revisit some of these points when we bring it all together in the Jamboard towards the end of the session. Conscious of the time as well. So we have next speaker, Oscar. Oscar, who works as a consultant for UNHCR in Peru. So he's going to talk about the experience of contextualizing and localization in the context of child protection in Peru. Over to you, Oscar.
Thank you, Cliff, and good day for everybody. I'm in Lima now, so it's good morning from this side of the world. Well, I'm Oscar. I'm pleased to be here in this presentation. The previous presentation of my colleagues is going to are very useful for the specific topic I'm going to talk about, and it's the Peruvian experience, specifically the child protection system to face the special needs of children on the move. So we are going to give a little context. In the next slide, we can see a few bullet points because this is a new situation to face in this country, in Peru. Since 2019, we have let's say an increased movement of persons, especially people coming from Venezuela. And early statistics from 2021 says that we have 1.2 million people in Peru. So Peru is a middle income country with a lot of disparities and of course not prepared to face this type of situations. In Peru, the Ministry of Women and Vulnerable Populations is the national authority of the Child Protection Service and the system. So to give you just some numbers to see the dimension of this challenge, only between 2018 and 2021, the child protection system of Peru attend 2,420 cases. And as I said, everything was new for the child protection system with no protocol for this topic, only general considerations. They were working, applying the principles of the best interest of the child and non-discrimination, because there was no option for the child protection system to exclude this specific group of children. But this group of children has special needs, as we would see in a few minutes. The practice of the alliance that I want to highlight to you is this agreement between UNHCR, Peru, and the Ministry of Women and Vulnerable Population, because in 2021, they realized that this is a long-term process. And it has to be, that we need an instrument to support this agreement. Because here in Latin America, and I know in other parts of the world, the political changes are very quick. So maybe something that an NGO or a UN office agree with an authority maybe the next week or the next month, they are not there anymore. So it's like starting again. So these type of agreements are very useful in this type of context. So as we can see in the next slide, the agreement between the Ministry of Women and Vulnerable Populations and UNHCR has two activities that I want to highlight. First, to build a specific protocol for the child protection service, because it was required, because it was very new for all the professionals, all the teams. So one of the decisions is to build a specific protocol, which is it will be approved in the coming months. And the other situation is the training of the teams. But first of all, both teams, the UNHCR Peru team and the team of the Ministry of Women and Vulnerable Population, realized that we are under a very specific situation for this group of children, as we can see in the diagram. In the middle, we have the children, which is the way that all child protection services have to work. But we need to realize that not only the regulations or the obligations of the Convention of the Rights of the Child are the only ones to apply it. Because as we can see here, we have also state obligations, which are a part of the international law for refugees, and also the very general fundamental obligations, part of the human rights system. So we need child protections professionals in line with all these three aspects, plus other ones, because if we have adolescent, women, indigenous, and with special needs, adolescent, as I said, we need to add extra obligation of the state. So that's the main challenge for these professionals. So to give a very useful hand to these teams, because they have a big amount of cases every day. So we need like very easy documents, easy training programs, and more. We developed, or we asked them to have a systematic approach inside the child protection system, as we can see in the next slide. So we prepared these charts to help them to reach this approach. The traditional attention in the child protection system in Peru was more focused about considering the presence of family, plus the general approach of the child protection system, which is to analyze the family and social context and conclude if they have or not parental care. But as we can see in the next columns of the chart, there are very important aspects these teams need to realize when they are attending a case in the first line service. The need of international protection, which is fundamental because we have specific and mandatory obligations if we are talking about refugee children. Also the aspects of nationality and also the immigration documents, because it is an obligation in the case of Peru to promote the regulation of the immigrant situation of all these children, you know. But we are at this point, if I can say it very quickly, that we have all the general regulations and mandatory obligations assumed by the international treaties, but we don't have all that aspects implied by the first line professionals. So that's the main challenge for this intervention. So in the next slide, instead of giving you conclusions, considering that we are in an ongoing process, we separated short-term and medium long-term challenges. In the short term is also, as I mentioned, continue the training of the interdisciplinary teams of this child protection service, considering that in all countries, the high level of mobility of these services. We train one group of professionals today, and in 6 months, we have new people there. So we need to build a training process considering this aspect. Also, this alliance between the UNHCR Peru and the Ministry of Women and Vulnerable Populations needs to be replicated by other authorities related with this, with the rights of the child, like health, education, immigration, etc. In the medium long term, we conclude, or we are aware that we need to promote legislative modifications, because we have to put all the national regulations in line with the international agreements that Peru already signed. So we need to, we have the base for this process. And also, in the medium long term, we need to advocate for the allocation of resources, because a good child protection service needs professionals, need financial resources. So we need to be aware that it's not only the protocol of the training that will solve the problem. We also need to be aware about the administrative and also the human resources implication for this service. Just to finish in the last slide, I will leave you with a question. Maybe I will start with this, but I decided to put it at the end because this is something that it's not it's not an equation. I cannot say I have the solution for this. So we need to think, considering our specific context, which challenges I identify in my home country for this group of children considering with their particular vulnerable situation. So all child protection services in all around the world maybe are not facing today this type of cases, but we need to learn by the experience of Peru that you need to be prepared. All child protection services need to be prepared for this type of cases, because from 1 month to the other, in 2019, we started to receive this type of cases, and the child protection service wasn't prepared. So let's learn everybody for that. Thank you for your time.
Thank you so much, Oscar. It's a very interesting approach in terms of, again, contextualizing engagement of the national systems in providing protection to children in mixed movement and refugee children themselves. There is a question in terms of the possible role of the Alliance Advocacy Working Group in your advocacy efforts to increase funding for child protection. So I'm not sure if you have any thoughts on that. And I would like to also come back with another question more about the role of the refugee or persons on the move themselves in this whole process.
Yes, thank you, Cliff. I want to highlight the comment about the funding because it is very important. It's not it's one element like the rest of the others, like the training, like the specific protocols, and more. And I can suggest, sorry, from the Peruvian experience that this alliance between the UN agency like UNHCR and the child protection system give a technical assistance and also is a strength for in this case, the Ministry of Women and Vulnerable Population to go to the budgeting authority of the country and say, see, this topic or this problem is urgent, and we have these agreements, and sometimes these meetings or this advocacy is accompanied by also the UNHCR office of the country. So this is like a tip, let's say, if I'm going to say it in a very colloquial way, but having strategy alliances also reflects not only in technical assistance, but also in the opportunity of budgeting. And for your from the other part of the question, Cliff, yes, I absolutely agree that all the refugee, the representation of the refugee persons needs to be present. And I want to say that during the construction of this protocol, we consulted and we involved refugee organizations here in Peru, specifically a few of them headed by Venezuelan people, because they know what's the problem, and also they can involve themselves into the solution. I was listening to Mara's presentation, and we were talking about that the last a few days ago during a training session. This refugee Venezuelan organization said, well, I want to be part also of, we want to be part of the solution. We have a group of adult persons settled in Peru with the opportunity and also apply for foster care, because they can fit all the requirements. So in that way, I guess that's a very good example of how this group of people integrated in the country also could be part of the solution for the children without parental care. So back to you, Cliff.
Thank you so much, Oscar. Thanks to all the speakers. It was very important points that were touched upon, both starting, of course, with Amy, Janna, and Job, who talked about the role of child-friendly spaces and the impact this can still have and the importance of this, and also reflecting on the need for how communities are engaged in this process from the outset. Mara spoke about the contextualization, the need for democratizing knowledge, and the engagement of information from the local practices as well, the way solutions in terms of alternative care is in practice, and how we need to build on that as well. And Oscar, you spoke about the role of the national child protection systems in essential need to strengthen these processes in order to ensure the services are aligned with the needs of refugees and children on the move. We do have a kind of continue the conversation through a Jamboard activity, but I just have a few points to kind of expand upon, especially when we talk about refugee context. Of course, we heard from the context in Uganda, we heard from the Mexican example, and as well as the example from Peru. But also it's important for us to keep in mind that refugees themselves face multitude of barriers in terms of their ability to participate and engage and be the owners of programs. This may be due to different legal constraints in the ability to move within the country where they are, the right to work, and so on, does pose specific challenges. We touched upon this also earlier. While we build programs in refugee context, be it in an urban setting or in a settlement or a camp setting, new emergencies, new influx of refugees means that the programs need to be adaptable in order to ensure newly arriving refugees and their views and their needs are also considered in terms of how we localize our programs. They're part of this process in a way. And also we need to think in terms of how localization links with and contributes to durable solutions overall. Amy mentioned the importance of starting at the outset of engaging with communities, understanding their priorities in terms of their ownership and how we perceive what refugee-owned and refugee-led processes would be. So that conversation and interaction is quite critical. And here it's goes without saying the voices of children, adolescents, those who are soon to transition to adulthood are quite vital. And then we need to also recognize, I guess, that when we talk about refugee population, population of persons on the move, and mixed movement and so on, is that it's not a one group of people. There are varying concepts, varying understanding of what their rights are or what their priorities are. We have LGBTIQ plus people. We have different ethnic groups within the same refugee population. So when we talk about localization, what do we mean? How do we ensure that these diverging views and opinions and needs are also reflected in our program, and ensure that not only voices are heard, but there is this ongoing process of transfer of power, the transfer of approach in terms of democratization, as Mara said. Having said that, and with these points also, just wanted to share with you a Jamboard and hear from you. What do you think would be, I mean, if you can bring up the Jamboard, please. What's the screen? So yeah, exactly. So based on what you have heard, what would you do differently, and how would you tackle the issue of localization, ensure that transition in power between humanitarian actors and local communities can look? So we'll be interested to hear what your thoughts are, how you would think we can go forward, and then we open for a conversation as well. So perhaps while we wait for the participants to contribute to the Jamboard, perhaps invite Oscar, Mara, Amy, Janna, and Job to speak a little bit more about this contextualization and localization, especially in a volatile refugee context.
Can I make one comment?
Go ahead, Mara.
Yeah, so I saw your comments saying like my organization does this, my organization does this. Yes, I know we are on a talk on localization at the annual meeting of the Global Alliance. Okay, my message is not addressing you. What I say is, please let's all join our forces and advocate so that everyone, so all of the decision makers that have a stake in involving populations in decision-making, knowledge creation, especially involve marginalized populations. As I said before, and okay, Oscar talked a little bit about this, governments are not super interested in doing this, as we know. Okay, so both groups in many Latin American countries, children and asylum seekers, refugees, people on the move are the least priority because they are not the constituencies of our governments, as we all know, and this happens in all countries, not only Mexico or Peru or Argentina. So this was my call for action. And I know that everyone works really hard here to achieve localization for real effectively. So my message was not for you. Don't feel offended. My message is for us to advocate for everyone to do what we are trying to do, basically.
Thank you, Mara. And I see a few points shared in the comments in the Jamboard. One participant mentions that intentional capacity building of local groups and partners. And I also see include advocacy from the outset in programming, and this especially in terms of the role of refugees, the role of displaced communities, role of affected population and children that we work with. Investing in consulting communities and simple research is another key point that is raised. And I think perhaps we can highlight also in your work, Amy, Janna, and Job, and Mara as well, and I see Oscar's hand up, how some of these comments can be incorporated, or next step at least. Oscar, over to you, since you have your hand up.
Yes, thank you, Cliff. Yes, well, I want to add a little extra tip, let's say, to according to the localization approach that you mentioned. And it's that we are thinking about child protection systems. We also need to take into consideration where this service is working. Because in the case of Peru, we have a child protection service, but with 25 offices around the country. So we need to know where the people are, let's say. No? For example, a person from Venezuela are located, the majority in Lima, in the specific districts of Lima in the north area. But also we have in this topic a specific spot for this situation, which is the north borderline of Peru, between Ecuador and Peru, because people walk from Venezuela to Peru, crossing Colombia, crossing Ecuador. So the natural enter for them is our north borderline, which is a little bridge. And if you want to pass the immigration office, you do. And if you don't, you walk 500 meters to the west, and then you cross the borderline. So we have very open borderlines here in Latin America. So I guess that's also something necessary for the child protection system. Yes, you need like national regulation, but also you need to land specific strategies for specific regions or provinces or districts inside the country.
Thank you, Oscar. And I see also a very important point around ensuring ethnic, linguistic, and other minorities are involved in the response. Also, not to mention the role of children and their voices. Perhaps I'll ask Amy and Janna, Job, in your work in Uganda, how was there an issue around the linguistic diversity of different groups of refugees, and what would be some other ways to ensure that different voices are heard and there is a kind of a cohesive way forward?
Yes, thank you, Cliff. I've been following the discussions keenly, and just to first respond to the first question, what would we do differently? And to build on what Janna said, I think it's important to appreciate the fact that the refugee population have a potential to make sure that they are highly involved right from the design of the programs, and the different structures within the community are a resource themselves, making sure that the different structures within the community are highly involved in implementing child-friendly space and child protection programs. We have had situations of donor projects coming in and going off, reduced funding and all that, but empowering the communities, working with the communities, will actually not only yield the desired impact, but also creates an opportunity for sustainability, but also enhances the participation of community members during the programming. Yeah, in Uganda, it has been, we have had good strides towards inclusion of multilinguistic communities while accessing services. And yes, from the time of settling the refugees or persons of concern, also asylum seekers, they are put in specific locations where they are able to speak specific languages. We know that we are highly hosting refugees from South Sudan, and most of the war in South Sudan has highly been caused by tribal conflicts. That means when they come to Uganda, we are very mindful in ensuring that they are put in specific locations and there are opportunities in terms of leadership, in terms of representation of all the different tribes to make sure that we take care of all the tribes that are settled within Uganda. We have had situations where the minority groups have actually been left out because of the numbers. If the minority group, if we have a few children participating in a child-friendly space activities, we find that sometimes we don't have a translator to take care of such needs. But we have also been very deliberate in the toolkit in ensuring that we have all the categories catered in terms of having the child-friendly space animators or facilitators from different tribes so that they are able to facilitate learning for all the children from the different tribes from South Sudan. That's one way that we have been able to ensure that all the children with different linguistic needs are taken care of.
Thanks, Job. Thanks. And I see another point here, invest in consulting communities and simple research so we appreciate the diversity of views and don't assume on their behalf. I was wondering, perhaps just to expand on that, to hear and build on the views of children themselves as part of the localization process. I would be quite keen to hear if anybody in the speakers panel might have any thoughts on how we can do it better. What would be the role of children in the localization process itself? Because we need to recognize when we talk about localization, again, it seems like an imposed approach, right? We're talking about we are going to do localization rather than ensuring that the process itself relates to and aligns with the views of people. So perhaps I'll ask Mara and then Oscar to come in.
Yeah, so community-based decision-making mechanisms or popular mechanisms already exist in many countries, in many regions. And like me and Oscar, we come from a particularly politically mobilized region. So usually there's a neighborhood club or somewhere where people meet. Also, someone wrote here on the Jamboard in Spanish, strengthening the community committees, because in many countries there's also this model, Mexico is one of them, of community committees, child protection committees. So I would say, like, number one, already some cooperating with structures that are already in place. It is not like no refugee community has ever organized themselves. It is the opposite. So look for those organized ways of organizing that maybe are not Western looking like, let's say, like you call them somewhere in somehow, but that also do the same, so serve the same purpose of dialogue and debate, community debate and decision making. So I would say that, and the comités, these comités comunitarios that someone mentioned are an example of that.
Thank you so much, Mara. Oscar?
Yes, I want to share an example about how apply the participation is not easy as it seems. For example, here in Peru, in the case of the emergency with Venezuela, in a lot of cases we have adolescents, boys or girls, attended by the child protection system, they want to go back to their country, but they have the status of refugees in Peru. So as a state, you have the obligation, well, to apply the principle of non-refoulement. So how you balance that? So for that type of situations, a part of also take into considerations the voice and the view of the adolescent. In this case, you have to make a best interest of the child. Sorry, a balance. You need to apply that principle, because we have two very strong aspects to balance. So that's quite a challenge for the child protection professionals and authorities, of course.
Thank you so much, Oscar. Just to look at here, so I think that just to take the last point here, less agency-driven in community-based or community-led level work, and more focus on community-led child protection. It's something that, of course, we can recognize cannot be done overnight, right? There needs to be a process, because the way, in some respects, communities have come to expect a response from humanitarian actors versus the way humanitarian actors have been working for years and years. There needs to be a bridge. So I'm wondering if anybody had any reflections on what that bridge would be, and if anybody wants to even propose how much time it would take, and what would be the way forward based on the research and the work that you've done.
If I could just add one quick thing, I think, Cliff, I think one thing that has been alluded to, but also mentioned in some of the conversations, was really about the importance of having accountability mechanisms. And we do, I think there's intention often in terms of consulting children, communities, and adolescents, for instance, when we do design, but often the ongoing contextualization and localization work has to be more intentional. And I think the function of the accountability mechanisms, whenever we put in place, feedback, community feedback mechanism, this has to be, of course, accessible to the community's children themselves, but also the input coming from the children and the feedback coming from the children must also be considered, listened to, and taken on board whenever we looked at how we are adapting and adjusting programs. There also is an importance, I think, that needs to be made, a highlight that needs to be made around the role of our ongoing monitoring and evaluation work. And I think always there is a way of finding out what children are saying, what children are feeling, what children are actually, how children are receiving the interventions, and then how their feedback can be used when it comes to further improving our programs and improving future interventions as well.
Thank you so much, Amy. And thanks, everyone. We're almost coming to the end, and I just thought I'll kind of highlight a few points. So we started off by talking about the Alliance's strategic priority for localization. We stressed on the point around sharing and shifting power, influence, and leadership with community, local, and national child protection actors. We talked about the importance of looking at the opportunities for direct and flexible funding for local communities, national organizations working on child protection as well. What does it mean in terms of the way of working? It set up 3 objectives in the Alliance strategy: meaningful and principled engagement of communities in the process as equal partners in the process as well. It's also about the extent to which and the ways that we work towards ensuring the development and contextualization of our global standards, guidance, tools, and so on, are reflective of the priorities set by the communities, by the population themselves. And it's important that we talk about ensuring accessibility and diversity of learning opportunities. And we heard from Amy, Job, and and Janna about the research that they've done in relation to child-friendly spaces, the impact on children, and the possibility and the opportunities for further engagement of communities and community ownership in this regard. And Mara talked about the particular pitfalls of trying to adapt kind of procedures that are developed in one context to a different context. And it's a critical process where we need to think in terms of what already exists in the community, what already exists in the national systems, and so on. And Oscar spoke much more about that adaptation into national systems as well. And I wanted to leave you all with the reflection on how do we ensure localization of child protection programming in a context where there's continuous emergencies, new influxes of refugees, and diverse groups of refugees where different groups of marginalized groups of refugees may not have the same voice as a different group of refugees that are the majority within a community as well. So there's a lot to think about and a lot to reflect on as we work towards this process of localization. And having said that, again, I want to thank Amy, Job, Janna, Mara, and Oscar for their contributions, and also the contribution and the questions asked in the chat by the participants, and also the hard work done to prepare these presentations and in production of this session. So with that, I thank everyone, and I hope it was a useful experience for everyone who was here. The conversation shall continue, and yeah, looking forward to a future chat on this topic.
Thank you very much, Cliff.
Thank you very much.
Thank you all to all of the speakers. I'm David, I'm one of your producers. I'm just here to remind you now that you can move into the Philo link now, where you will have the chance to check out some of the infographic discussion sessions which are available to you there. So thank you very much indeed for attending such a useful session, and we look forward to seeing you soon.
Thank you.
Thank you.
Have a good day. Bye.
Thank you.
And please also complete the feedback form in the chat box if you
Thank
haven't
you.
seen it. Thanks.
Yes, thank you for that reminder. The chat box has got everything that you need. There's a feedback form there. You'll also find a copy of the PowerPoint from today's session.